I'm Chandra Price, the founder of the Medicare Teachers Agency. We are not part of the federal government. We're not endorsed by the federal government. We are independent brokers. You can reach us at medicare-teachers.com or at 866-READY65. We have brokers in many states who want to help you. Today, we're going to talk a little bit about Medicare and Medicaid. Because frequently those words, if you don't work in the insurance industry like us, they can get scrambled, and you kind of can forget whether you're meaning to talk about Medicare or Medicaid. So we just wanted to give you a refresher. Medicare is the federal health insurance program for people who are 65 years and older, or who have a certain disability and they've been on disability for at least 24 months. There are a couple other exceptions to the rule for when you can apply for Medicare. If somebody has end-stage renal disease or has Lou Gehrig's disease, you can also be enrolled into Medicare before you are 65. Now, one way to remember that Medicare is typically for people who are 65 and older is it ends in care. And Medicare, you care about your grandparents. And so that's one way to remember that Medicare it's the federal health insurance program for people who are over 65. Medicaid ends in aid. Medicaid is financial aid. It's assistance for people who have a lower income and are not able to purchase their own health insurance, or maybe they wouldn't have enough money to get their own health insurance. Medicaid is state-based, whereas Medicare, it comes from the federal government. So the rules can vary for Medicaid by state. So you want to look into your particular state about who qualifies for Medicaid and how you apply for Medicaid in your state. With Medicaid, there are two different kinds of Medicaid. People call these assistance programs Medicaid, but technically there are more specific words for it. So the regular Medicaid is for people who are under 65 who have low income, and that's their health insurance. So if somebody is very low income, they have low income and low assets, they can apply for Medicaid through their state, and that is their health insurance. And Medicaid, since it's state-based, typically only pays within the state that the person is a resident. So if you are traveling outside of your state, you may or may not have travel coverage if you are outside of your state and using a Medicaid plan as your health insurance. Now, the other kind of Medicaid is technically a Medicare Savings Program, MSP. And when people talk about this plan, they usually just use the word Medicaid, but it technically is a Medicare Savings Program. And these Medicare Savings Programs offer financial assistance for people who are on Medicare. So if you are enrolled in a Medicare Savings Program, it may pay for your Part B, B as in boy, premium. It might pay for your Part B premium, but also might pay for any deductibles or cost sharing. It depends on the level of the Medicare Savings Program that you qualify for. And the qualifications are based on income and assets. Sometimes you'll hear people who have both Medicare and Medicaid as somebody who is dual eligible, or who is Medi-Medi, right? Medi-Medi because Medicare and also Medicaid. Dual eligible because Medicare and Medicaid. So if somebody is dual eligible, oftentimes there are specific programs, specific plans that are available to people who are dual eligible. Because their income and assets are so low, they get some extra support so that their medical costs and some extra costs might be picked up by a plan that they might enroll in. So just to recap, Medicare, federal, Medicaid comes from your state. Thank you for watching.